I'd just like to talk about some of the figures not mentioned by the Minister. In terms of hospitalisations, we now have 1,164 people admitted to hospital with COVID. This includes 221 people in intensive care and 94 of those requiring ventilation. Sadly, we've had to report 8 deaths of people with COVID in the last 24 hours. I'll just go through those deaths. A man in his 70s from Western Sydney who died at Blacktown Hospital. A man in his 30s from Western Sydney who died at home and was tested positive after his death. A man in his 40s from southwestern Sydney who died at home and tested positive after he died. A man in his 70s from Western Sydney who died at Royal North Shore Hospital. He had underlying health conditions. A woman in her 80s from Sydney's southern suburbs who died at Sutherland Hospital. A man in his 80s from southwestern Sydney who died at Liverpool Hospital. A woman in her 80s from southwestern Sydney who died at Campbelltown Hospital. And a man in his 50s from Western Sydney who died at Royal North Shore Hospital. As mentioned, none of these people were vaccinated. We extend our sincere and deepest sympathies for the loved ones of these people who died. There have now been 170 COVID-related deaths in New South Wales since the 16th of June and 226 in total since the start of the pandemic. We've had a number of sewage detections as part of our ongoing surveillance program to detect evidence of COVID or fragment of the virus that causes COVID. These have included in Byron Bay and Bangalow, in Jindabyne, Harden, Moruya and Yass in southern New South Wales, in Port Macquarie on the mid-north coast, Trangie in western New South Wales and Young in Murrumbidgee LHD. We've not identified recent cases in these locations, so again urging anyone in these locations to be particularly aware of symptoms of COVID and come forward for testing with even the slightest of symptoms right away. The suburbs in Sydney with the highest numbers of cases continue to be in western and southwestern Sydney, particularly the suburbs of Auburn, Greenacre, Merrylands, Liverpool, Punchbowl, Granville, Bankstown and Guildford. Just highlighting Western New South Wales, cases continue to occur in Western New South Wales and the far west. Across Western New South Wales Local Health District, there have been 16 new cases of COVID reported to 8 o'clock last night, bringing the total number to 952. In the far west, there's been 13 cases reported yesterday, including 10 in Broken Hill and 3 in Wilcannia. The total cases in Far West so far has been 149, including 116 in Wilcannia and 32 in Broken Hill and 1 in Balranald. Thanks very much.